Caregiver Action Network, previously known as the National Family Caregivers Association, is proud to present Communicating Effectively with Healthcare Professionals.
Welcome to the National Family Caregivers Association's Communicating Effectively with Healthcare Professionals program. NFCA educates, supports, empowers, and speaks up for millions of Americans who care for loved ones with a chronic illness, disability, or the frailties of old age. NFCA addresses the common needs and concerns of all family caregivers, regardless of their loved one's age or diagnoses, in order to build their confidence and capabilities and help transform the quality of their lives. We are grateful to the National Association of Chain Drug Stores Foundation and the Jacob and Valeria Langeloth Foundation for sponsoring the development of this on-demand version of the Communicating Effectively program. We hope in viewing this presentation you will gain an appreciation for the very important role you play on your family member's healthcare team. In addition, you will learn how good communication techniques can and will make a difference in the care that your family member receives in the healthcare arena. And finally, you'll learn strategies to better prepare for medical visits, whether in your physician's office or in the emergency room. As a family caregiver, you need to know that you are not alone. Rosalyn Carter said it best. There are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. As the population continues to age, you will be hard-pressed to meet someone who does not know a family caregiver or is not one her or himself. Poor communication with healthcare providers can cause mishaps or errors in treatment. For example, problems with medication errors could lead to very serious consequences. In addition, opportunities for improving care can be missed due to problems with communication. The Communicating Effectively curriculum has been proven to change the way family caregivers behave in healthcare environments. Research indicates that caregivers are more confident in their communication interactions, and they change their behaviors in relation to preparing for medical visits, what they do during medical visits, and how they follow up. This curriculum promotes better healthcare outcomes for their family members and themselves. As the family caregiver, you are part of the healthcare team that cares for your friend or family member. In addition to you and your care recipient, other teammates include the primary care physician, nurses, pharmacists, and medical specialists such as oncologists and hematologists. There might also be home healthcare aides, social workers, various therapists, and clergy. A whole network of individuals exists to assist you in the process of caring for your family member. How can a family caregiver keep track of all these team members? One suggestion is to purchase a business card holder located at any office supply store. As you interact with members of the caregiving team, you can collect their business card, write on the back what their role is, and put it in the card holder. On any team, there are various dynamics in relationship to power, such as who has the power on the healthcare team. As the family caregiver, you have a special kind of power. You know your family member or friend better than anyone else on the healthcare team, and realizing your power is important, and therefore you have valuable information to share. Healthcare communication can be influenced by the relationship between the caregiver and their loved one. It's important not only to have clear and effective communication with healthcare professionals, but also with your family member. The Communicating Effectively model is based upon 4 key principles of effective communication, including establishing presence, participating actively, building mutual understanding, and encouraging collaboration. These strategies will improve your communication with healthcare providers. They will also improve your overall ability to communicate with others. An important step in healthcare encounters is establishing presence. A person with presence might be seen as a force to be reckoned with, or as someone who is noticed by other people. By staying in the moment, you remain calm and collected, allowing yourself to communicate what your concerns and needs are in relation to caring for your family member. If you establish your presence, you are fully present mentally and physically. You can hear what is being said. You can process it. You can write it down. You can ask questions. You can appropriately respond. These steps allow you to maintain a strong sense of self. You are an important vital member of the healthcare team, and you can help other members of the healthcare team realize and understand that. When establishing your presence during a first meeting with a healthcare professional, you might want to shake their hand and introduce yourself. For example, "Hello, Dr. Smith. My name is Lori, and I'm the daughter of Paul. He lives with me, and I am his primary caregiver. This statement lets them know what your role is and that you are an important part of your family member's treatment. Next, you can establish rapport. Rapport is a good working relationship. You want to have a good, strong connection with the healthcare professional so that you can lay the groundwork to be able to move forward in helping to realize positive treatment outcomes for your family member and also an understanding of your needs as the person providing care. In addition to establishing presence and rapport, it's important to participate actively. The healthcare system is set up in such a way that it is actually easier to be a passive participant, but being passive is not the way to get the best care possible. Research shows that patients who are more active in their healthcare have better health outcomes. How can you actively participate? First of all, be prepared by making the decision to plan, organize, and take the time to think through your goals and objectives with each encounter with healthcare professionals. Being prepared is critical to maintaining good communication throughout the treatment process. Part of participating actively is clearly stating your purpose. It's important to sit down with your family member before you go to see the doctor. It is important to talk about what's going to happen during that visit. What are the concerns that need to be addressed? What information needs to be relayed? List the reasons you are seeking medical help. It's helpful to write these concerns down and develop a healthcare diary or a healthcare journal, possibly a spiral-bound notebook where you keep track of all information related to your loved one's health. Write down your questions and concerns as you prepare. Then, write down what the physician says in response and any follow-up concerns you may have. This way, it's all in the same place. Once you've thought through ahead of time why you're seeking medical help, when you go into the visit, you want to state your objectives clearly and concisely. Remember, time is limited with the healthcare professional. Prioritize your concerns and be efficient. Try to offer relevant information and establish what's most important. This is a matter of selection and focus and stems from your goals and objectives. Learn how to prioritize and put the most pressing concerns at the beginning of your list, focusing on those essentials first. As you go through the visit, your perspective on what you initially presented first might change. Ask questions. It's important for you to write questions down and prioritize them before and during your visit. You want to make sure and clarify any incorrect assumptions and disagreements as quickly as possible. Otherwise, assumptions and disagreements can become barriers to effective treatments. Although your time with the doctor may be limited, ask questions until you're certain you understand what is taking place, what your family member needs, and what you should be doing. Some examples of questions that you might want to ask are, how do you want to treat this illness? Another question might be, what are the risks of treatment you're recommending? Physicians often recommend tests. You might inquire, is the recommended test necessary to confirm or disprove a diagnosis? And will the findings of the test change how the illness or the disease is managed? In terms of participating actively, it's important to be assertive. Remember, assertiveness is not the same as aggression. Skillful assertiveness is an interpersonal communication technique that will enhance your relationships, build understanding, and encourage collaboration. Aggression is a behavior that can destroy relationships. It can make it difficult to establish and maintain rapport. Aggression can also create unnecessary conflict. You will need to be assertive to get the information and attention that you and your family member needs. If you expect to be led through the healthcare system step by step, you're more likely to learn passive compliance. Recent research findings support the need to carefully develop your assertiveness skills. Patients and caregivers who appear overly helpless can discourage the doctor from truly interacting. And patients and caregivers who blame the doctor for their condition are less likely to get good care. Assertiveness is a way to respectfully communicate your needs and your concerns about the issues you're facing as a family caregiver. Your next goal is to build a mutual understanding. Building true understanding involves several interactions to create trust and openness. These are the hallmarks of mutual respect. Unfortunately, this cannot occur in all healthcare encounters. Family caregivers might see a physician or another healthcare professional for only 1 or 2 visits. Several interactions to establish respect and true understanding might not be available. Even if you are only seeing a healthcare professional for a few visits, or if this is an ongoing relationship, using active listening can build mutual understanding. Active listening is listening carefully, with full attention to what the healthcare provider is saying, and then validating that information. There can be a difference in what someone says and what others hear. It's important to make sure that we are receiving the information the way that it is intended. Ask for clarification. Believe that any question you have is an important question. If a physician or other healthcare provider is using medical jargon, ask if you don't understand what the words mean. It is perfectly appropriate to insist that healthcare professionals explain themselves in everyday language. You can demonstrate understanding by clarifying what has been said and repeating back important pieces. For example, I want to make sure that I understand you correctly. You're saying that, and then basically you are rephrasing what you understand the healthcare provider has said to you. You want to avoid assumptions by building understanding with others based on respect and courtesy. Always state difficulties and concerns. When speaking with healthcare providers, ask them to listen to any concerns or questions you have. Many family caregivers express that the physician simply doesn't listen to them. Under those circumstances, try to be respectfully assertive and say something along the lines of, "I know, Dr. Smith, that you're really busy, and sometimes when I come in to talk with you, I don't feel like you're fully hearing what I'm having to say. I really need you to understand my concerns. Can we take a few minutes and talk about them?" As mentioned earlier in the presentation, active listening is extremely important. This process is driven by a conscious effort to understand someone else. Active listening has 3 components: sensing, interpreting, and checking. The first component is sensing. In general, people gather information in 3 ways. We pay attention to the words that are spoken. That's the verbal component. We pay attention to the vocal component, the tone, the rate, the volume. And finally, we sense information through a visual component, body language, facial expressions. We pay attention to all 3 of these components in active listening. What are someone's words saying? What are their bodies saying? What is the tone saying? And if something contradicts, ask for clarification. The second active listening component is interpreting. Interpreting is helping you to understand, in your own way and in your own words, what is being provided by the healthcare professional. You might say to a healthcare provider, "I get the feeling you think these symptoms will not abate, even with new treatment." You are making clear to the healthcare professional how you are interpreting the presented information. The last component of active listening is checking. Checking is clarification, to confirm that what was sent in the healthcare provider's message is what you received. One example might be, "I'm not clear what the consequences are if she misses a dose. Should she skip the current one and double the next?" Again, asking for clarification. This will build mutual understanding. Use I statements. One example of an I statement is, "I think my mother will respond to you better if you speak louder," instead of, "You always speak so softly. It's no wonder she can't hear you." There's a big difference in the 2 messages, especially how they might be received by a healthcare provider. The healthcare professionals will hear you better and be less defensive if you use I statements. An important piece of clear communication is using facts rather than opinions. Allow the healthcare professional to provide their diagnosis. For example, "My wife has been coughing for 2 weeks," versus "I think she has bronchitis." By providing this information about her cough, the healthcare professional can do the diagnosing and ask your wife questions directly or ask you about the changes you have observed in her. It's important to use facts objectively to describe symptoms instead of giving opinion-based statements. The main goal as a family caregiver is to actively collaborate with healthcare providers to meet the needs of you and your care recipient. To review, one approach might be to focus on common goals. You want to focus on identifying and achieving the goals that you, your family member, and the healthcare providers can agree upon. However, you also want to be willing to change these goals if necessary, if there has been a change in a person's health condition. Discuss and agree on the actions that need to be taken to achieve the goals. Another approach is to seek clarification by asking. You want to be clear about who is responsible for what and how treatment recommendations might be followed. And finally, another tactical approach is helping with problem solving. What can you do to assist the healthcare professionals in reaching the goals that you have agreed upon? These key principles for effective communication can impact situations in a doctor's office as well as in the emergency room. Doctors' offices have personalities, just like people. It depends partly on the size, the type, and location of the practice. It depends on whether the practice is an independent clinic or part of a larger health system affiliated with a hospital or medical center, and whether they have adopted electronic health records. It also depends on the personalities of the individuals who make up the staff and how well they work together, and it certainly depends on the personalities of the physicians themselves. In spite of all this variation, if you learn how their office system works, you and your family member have a better chance of having a positive healthcare experience. The following tips will help you find out how your particular doctor's office functions. First, find out about scheduling procedures. Who do you make the appointment with? Are there cancellation fees? And what are the hours of operation? Usually doctors won't have time to answer your questions over the phone, and most offices prefer that you start by speaking with a nurse or physician's assistant. These healthcare professionals might be able to help you make appointments, answer general medical questions, look up information in your family member's chart, possibly provide test results, confirm medications and dosages, help arrange for prescription refills, and aid in emergencies. They can also consult with the doctor in between patients and get back to you relatively quickly with answers to your questions. However, if you have a complicated question, don't be afraid to ask to speak with the doctor. The staff will help you determine who can best address your concerns. Learning the names of the office staff can go a long way in helping you establish personal and cooperative relationships. Knowing the best time to reach the doctor is important. Some doctors do have specific hours in the morning or evening, during which they take calls, answer faxes, and email messages. It just depends on the practice and the physician. If you really do need to speak to a physician, it will speed things up if the doctor has some idea as to why you're calling. Provide the nurse or the receptionist with a one-sentence summary of your primary question. Sometimes a nurse practitioner or a physician's assistant will be able to provide the answers you need. Don't be afraid to talk to one of them first. Make sure you leave all of the pertinent numbers where you can be reached at various times during the day so that the doctor has the best chance of actually connecting with you. Keep in mind the following questions regarding insurance and billing procedures. Does the office accept your care recipient's health insurance? Who is responsible for the billing claims? What are the charges for typical services, which might include a standard office visit and possible copays? You may want to ask, what form of payment does the office accept? And if your care recipient is eligible for Medicare or Medicaid, does the office accept that as full payment, or is there an additional charge? Always make sure to get the contact information of the billing office staff. Now that you understand the important questions to ask about how the office operates, you need to focus on where you are going to keep all the information you have learned. Where are you going to keep track of questions to ask the doctor, and equally important, the doctor's answers. Remember to keep a question and answer journal. The journal should be part of a more extensive patient file. A patient file is a place to store all your care recipient's medical information. You might use an accordion file, a 3-ring binder, a big manila envelope, or a file folder to contain these documents. Keep your file in the same place so you'll know where it is should an emergency occur, or when you need to go to a physician's or other healthcare professional visit. What are the components of the patient file? You want to have a personal medical record. First, you can get a personal medical record form online. It can include places for you to write the diagnosis, physician contact information, medications, any allergies, and health history. Remember to make copies. The most important piece of the personal medical record is the medication list. That medication list should include the name of the medication, the dosage, what the medication was prescribed for, who prescribed it, and it should also include any over-the-counter medications that are being taken as well, that have not been prescribed by a healthcare professional, and this should always be kept up to date. A personal medical record should also include all health-related insurance information, copies of cards for private medical insurance, Medicare or Medicaid, long-term care insurance, prescription drug, dental, vision, or any other insurance. If your family member has completed an advance directive, you want to have a copy of the family member's living will, a durable power of attorney for health care, and if you have it, a power of attorney for finances, any prearranged funeral plans, attorney contact information, and it's also really important to have a list of individuals that should be contacted in an emergency, and any other legal documents that are important. Having your patient file will help you go a long way in preparing for medical visits, going to the ER, or any other healthcare encounter. In that meeting with your family member, you will want to review any medical changes since the last visit. Write down and prioritize any primary concerns and questions. For example, pain that your family member is having, any side effects from drugs that have been prescribed, any diet issues. And you want to bring that to the visit. Remember to put all of this in your healthcare journal. Before going to a medical office visit, make sure that requested tests have been completed and that the doctor has received the results. For example, did you get the blood work done? Did you get the scans done? More importantly, have these records been sent to the physician's office? Your visit to your healthcare professional's office can be a big waste of your time and your family member's time without these tests. Call the physician's office to ensure that information was received. After the medical office visit, recap the meeting and prioritize the important issues. During the visit, find out what it is that you should be monitoring and what it is that you should be writing down. This will make you even more prepared for the next visit. Is it monitoring the patient's overall health status, any side effects of medications, how the illness is progressing or getting better, completing upcoming tests, watching for changes in eating habits, temperament, energy levels, or anything that is directly related to your family member's chronic illness? No matter how much attention you pay to your family caregiving responsibilities, emergencies are going to happen, and you should be prepared for them. If you're well prepared, you will cope more effectively when that day arrives. In preparing for emergency room visits, prepare to report symptoms succinctly. Write everything down. In an emergency, stress can be high, and it might be difficult to stay in the moment. Remember to bring an up-to-date medication list and medical history. These items should be located in your patient file. Make sure to pack a bag of essential supplies ahead of time for you and your loved one. These essential supplies might include slippers, a change of clothes, toothbrush and paste, daily medications, and maybe a book to keep you occupied. Always be prepared. At the emergency room, make sure to introduce yourself and your relationship to the patient. Make it very clear to the emergency room staff that you are responsible for your family member's care. You want to convey needed information. Try to give the staff some distance, but remain close by. If you are needed for information, you are available, but not in the way of the treatment team. This can be difficult. Inquire about your family member's condition and ask for regular updates. It is reasonable to ask emergency room personnel every 30 to 45 minutes. If they're not approaching you, it is appropriate to ask every half hour, what's going on? What sorts of information might they need? Calmly interact with your loved one and the staff, and make sure to express your thanks, especially if you've received great care. Healthcare professionals will remember when they have been thanked, and they will appreciate it. Use the key principles of effective communication to promote understanding and collaboration in healthcare environments. Remember to participate actively, build mutual understanding, encourage collaboration, and always establish your presence. Keep in mind, active listening involves the following components: sensing, interpreting, and checking. Always make sure you're on the same page as the healthcare provider. A complete and frequently updated patient file and a checklist is a critical part of ensuring that your family member gets the safest and most appropriate care. Remember, you want to put that file in a place that you can find it easily in case of an emergency. It's important to understand how a doctor's office works and to prepare for visits. Planning is required before each step, before the visit, during the visit, and following the visit. NFCA has developed a downloadable toolkit that provides useful checklists for planning the doctor's visit and guidance on how to report symptoms or communicate with insurance companies. The toolkit includes a patient file checklist and offers insights into good communications practices. It may be found on the Attachments tab of this presentation. Thank you for viewing this presentation on communicating effectively with healthcare professionals. We are grateful to the National Association of Chain Drugstores Foundation and the Jacob and Valeria Langeloth Foundation for sponsoring the development of this on-demand version of the Communicating Effectively program.